This video was made to empower veterans with self-care strategies that may provide relief for neck pain. You can follow along with this video as we demonstrate the technique for 6 acupressure points. You may perform this self-care routine in addition to your regular medical care. It is not intended to replace standard medical treatments for this condition. This acupressure routine may not be appropriate for some veterans, including those who have brand new symptoms or who are pregnant. It is best to sit or lie down while applying acupressure. If you experience any discomfort, dizziness, or other unusual symptoms, stop the acupressure immediately. If these symptoms do not go away, contact your medical provider. Do not use acupressure over areas where you have a wound, severe swelling or lump, active infection, recent blood clots, rash, or areas that are very numb. However, you may be able to use other points away from these areas. If you take medications to thin your blood or have a bleeding or clotting disorder, only use light pressure. Acupressure is thousands of years old and likely predates acupuncture. When we have a headache, we have a tendency to put our hands to our temples to relieve the pain. Putting our hands on areas that hurt and rubbing or pressing is a very natural thing to do. Acupressure can be used to treat a variety of conditions. This video will teach you an acupressure routine that may relieve neck pain. I invite you to follow along on yourself as we demonstrate each point. To perform the acupressure routine, you will press or massage the points that you will be taught in this video, usually for 30 seconds each. Use the amount of pressure that feels comfortable to you. Enough pressure to feel some sensation. If painful, use less pressure. Sometimes a light touch is all that is needed. The first point is actually a pair of points found on the back of the hand. To find these points, make a loose fist and locate the area just below the knuckles of the 4 fingers. You will see and feel 3 soft spots between the tendons. Find the point between the pinky and ring finger, and the second point is between the middle and index finger. You can press both at the same time or separately. To press them both at the same time, you can hold your hand like this, or like this. You can also rest your hand on a table or your lap and press the points so that your hand is supported, like this. To press one at a time, pinch the front and back of the hand at these points and hold for 30 seconds, alternating back and forth between the 2 points. If it is uncomfortable to pinch and hold these points, you can use a pencil eraser to activate this set of points. Hold and press or massage the points for 30 seconds. Many of these points can be done on both sides. In the video, we are only going to show you how to do the point on one side. If you would like to do acupressure on the same point on the other side, feel free to pause the video and resume the video when done. Another helpful neck pain point is SI3, particularly for neck pain that starts at the base of the neck. This point is found on the pinky finger side of the hand. If you make a loose fist, feel for a depression or low spot under the knuckle. When you press this area, you may notice a spot that feels more tender than others. You can focus your pressure on that tender area, but not to the point of causing pain. If it is uncomfortable to use your hands to press points, you can try using a pencil eraser instead. Again, hold or massage this point for 30 seconds and pause the video if you would like to do this on the other side. GB20 is helpful for neck pain. These points are found at the back of the neck, just within the hairline. They are located about 1 inch on either side of the spine, just under where the head meets the neck. Feel for a tender depression or hollow to press and hold or massage. You can rub this point on both sides at the same time if you are able and it feels good, or press one side at a time. There are many ways you can place your hands to reach this acupressure point. You can use the pads of your fingers like this, or your thumbs like this. You can also try lying down face up and support your arms with pillows while you press these points. If you have trouble reaching this point, you can also ask a caregiver to press it for you. The next point is called Bai Lao, which translates as 100 labors, meaning this point will help when it feels like you are carrying the weight of the world on your shoulders. To find this area, start by curling the pads of 2 or more of your fingers around the back of your neck until they meet in the middle of your spine. From the middle, move your fingers out on either side about 1 inch and press to find a tight or tender area. Avoid putting pressure directly on the spine. You can press both sides at the same time or press one at a time. If the muscles here feel tense, you may rub these muscles gently using a circular motion, or you can try moving your fingers across them back and forth or up and down. You can also apply direct, steady pressure with your fingertips. Another way to try these points is to use your whole hand instead of just the fingertips to cover a wider area. Press and rub this area or follow these muscles up and down along their length using the motion that feels right to you. Again, hold or massage this point for 30 seconds. And if you did one side, pause the video if you would like to do this on the other side. The next point is GB21. This point is great for many types of neck pain and also used to help calm and relax the mind for stress. You may find yourself naturally rubbing this point for lower neck or shoulder tension. GB21 is found on the top of your shoulder, about halfway between your spine and the tip of your shoulder. Feel for a firm or tense muscle and press. Avoid pressing on anything in the front of this muscle. Stay on top of the shoulder. If you feel a tingling sensation or pain in your arm or neck, you are applying too much pressure. You can try pressing in a downward direction, or you can try rubbing in a circle on the tight band of muscle. Use several fingers to apply broad pressure to this point. Again, hold or massage this point for 30 seconds and pause the video if you would like to do this on the other side. The final point we will use is called UB60. UB60 is found on the outside of the ankle. Find the large rounded bone above your heel on the side of the ankle. UB60 is halfway between the high point of the bone and the big tendon. Press and rub this point gently. It can be a little tender here. It is best to sit to press this point. You can reach down to press the point like this, or you can try extending your reach with a pencil eraser. Or you can also sit and cross your leg to reach the point like this. If you have a hard time reaching this point comfortably, you can have a caregiver assist you. If it is not comfortable to do this point, you can skip it and focus on the other points mentioned in this video. Press and hold or press and release for up to 30 seconds. Pause the video if you would like to do this on the other side. This acupressure routine may be done many times a day to help you with neck pain relief. Please continue to pay attention to your body and do what feels right. If you find certain points to be helpful, focus on those points. If you find other points uncomfortable or hard to reach, skip those points. If you have discomfort with acupressure, stop performing the routine. If you have any new or unusual symptoms, or if your symptoms worsen, seek medical attention. Look for other videos in our acupressure series for other conditions. To download a handout with pictures of the acupressure points to use as a reference, please follow the link below.